One of the things that's really common on MPJE is they'll tell you that someone presents to the pharmacy with a prescription for a medication. They give you the medication name and they set up this super elaborate scenario. And you need to make a decision about what the pharmacist can do in that situation or what the pharmacist's options are to do in that situation. Getting that question right or wrong initially all begins with your ability to appropriately classify the drug. If you can clearly tell this is a Schedule II medication, you are going to be able to know exactly what that pharmacist under the law is able to do based on the scenario that you're being presented with that prescription. And so what are some of those medications that could commonly appear on your exam to make sure that you know that they're Schedule II medication? Up first are the opioids, right? Morphine, oxycodone, fentanyl, Dilaudid. Make sure that you know them by both brand generics and make sure that you know the combination products. So Percocet, for example, is a very common combination product that's a Schedule II. The next class that's going to be apparent as a Schedule II or stimulants, right? Adderall, Concerta, Ritalin, this class of medication will also go through the same regulatory compliance requirements that other Schedule IIs like morphine and oxycodone go through. And then you have other unique random ones that are Schedule II that people are always surprised about, like cocaine. Definitely has an appropriate medicinal use and is a Schedule II medication. And so take the time to really learn common Schedule II medications by both brand and generic, because the scenarios are usually going to be that you have to figure out. And if you miss that they are a Schedule II, you could completely get the question wrong.